Hi and welcome to my second video blog about my new treatment for my relapsed myeloma, which is the Lenalidomide and Dexamethasone. So 2 days ago I started it on Tuesday. It's now Thursday morning. First thing that happened after I did my last video blog is that I suddenly started to feel really quite sick and had to take a domperidone anti-sickness tablet to combat that. What that did was to stop me being sick, but left me feeling quite nauseous still. I also felt very tired, loss of appetite, felt quite hot and shaky. So yesterday I took my second dose, and this time I didn't feel completely sick, but I did still feel a bit nauseous, so I took another domperidone to try and combat that. I felt very tired and washed out again, and this time I felt a bit cold and shaky. So I thought what I'd do is look at the list of known side effects for lenalidomide, and it turns out that this lovely instruction sheet that comes with it lists 50 different possible side effect types that you can get. So I thought I'd just go through a few of them with you, just so you can see what kind of side effects this thing has. Obviously lenalidomide, as you might know, is sounds very much like thalidomide. It's actually a derivative of thalidomide and therefore has some of the associated problems that would have. So it's a definite no-no if somebody's pregnant or is trying to get pregnant, whether you're trying to get pregnant as a woman or whether you're a man trying to get someone pregnant as well. So very common side effects: fallen number of red blood cells, which may cause anemia leading to tiredness and weakness. Well, probably a bit early for that. Constipation, diarrhea, nausea, rashes, vomiting, muscle cramps, muscle aches, bone pain, tiredness, generalised swelling, including swelling limbs. Well, I've had the nausea and tiredness definitely. Fever and flu-like symptoms, including fever, muscle aches, headaches and chills. Well, had a bit of feeling hot and also a bit of feeling cold, and I've had some headaches as well so far. Numbness, tingling or burning sensations of the skin, pains in hands or feet, dizziness, tremor, taste disturbance, not that I know of yet. Decreased appetite, yeah, definitely so far I've not felt really like eating much at all, but I've probably got plenty of room for improvement on that sense anyway, so not really too much of an issue. Low levels of potassium in the blood, no idea about that. Leg pain, which could be a symptom of thrombosis. Well, because I had a deep vein thrombosis when I was on my initial treatment, and another pulmonary embolus as well in November 2013, I'm actually on fundoparanux sodium injections daily, which is a blood thinning agent, so that shouldn't be an issue for me, but it's still something to watch out for, I guess. Chest pain, shortness of breath, well, that could be a symptom of pulmonary embolism, but again, hopefully shouldn't be an issue. Infection of the lung and upper respiratory tract, shortness of breath. Probably won't notice that. I'm asthmatic and I take inhaler every day. I do a peak flow meter check once a week as well, so if anything's happening there I can probably keep an eye on that. Blurred vision, no. Headache, yeah, I do get headaches every so often. Those are the very common side effects which affect 1 in 10 people. Then goes on to side effects which may affect up to 1 in 10 people. Oh, sorry, the first section is more than 1 in 10. Then next section, infections of all types, infections of sinuses, bleeding from gums, stomach or bowels, increased blood pressure or fall in blood pressure, slow or fast or irregular heartbeat. Well, that covers pretty much everything. Increased pigmentation of skin, okay. Skin eruption, skin crapping, flaking or peeling of skin. Well, I already suffer a little bit from a kind of eczema type skin dryness on the top of my head, so hopefully that won't get any worse. Hives, itching, dry skin, increased sweating, dehydration. Well, I've always been told to keep well hydrated because of the possibility of blood clotting anyway, so hopefully that'll be okay. Sore, inflamed mouth, dry mouth, difficulty swallowing, no. Abdominal pain, no. Production of much more or much less urine than usual, which could be a symptom of kidney failure. Passing of blood in the urine, well, that should be an easy one to spot. Shortness of breath, especially when lying down, could be a symptom of heart failure. No thank you. Difficulty in obtaining an erection. Well, we'll pass on commenting on that one at the moment. Chest pain spreading to the arms, neck, jaw, back or stomach, feeling sweaty and breathless, feeling sick or vomiting, could be a symptom of a heart attack, myocardial infarction. Again, I think I'll pass on that one. Stroke or fainting, not at the moment. Muscle weakness, don't think so. Joint swelling, no. Change to blood thyroid hormone, low levels of calcium, phosphate and magnesium in the blood, no way to know that. Depression, well, as part of my medication for my peripheral neuropathy, I actually have to take a antidepressant anyway, which is to try and settle the nerves down. That one's called duloxetine, so I'm already on sort of a happy drug as it were anyway, so hopefully that's not an issue. Cataracts, well, the strong steroids started me developing a cataract in both eyes in 2013 when I was on my first stage treatment. I'm now on dexamethasone again, high dosage, so that's something to watch out for as well, but I'm due an eye test soon anyway, so I guess I can get that looked at and then again in 6 months time see what's going on there. Reduced vision, no. Deafness, what, sorry, no, fine. Abnormal liver test results, well, I don't test my liver every day. Impaired balance and movement difficulty, well, I get it anyway, so that's probably not going to be the easiest thing in the world to check, but I can keep an eye on that, I guess. Ringing in the ears, tinnitus, no. Uncommon side effects which may affect up to 1 in 100 people: bleeding within the skull, circulatory problems, loss of vision, loss of sex drive, again we're not going to comment on that one. Large amounts of urine again, inflammation of large intestine, bloating, diarrhea, renal tubular necrosis, skin discoloration, sensitivity to sunlight, skin tumours, so it could affect up to 1 in 100 people. So technically you could get skin cancer from taking this, which is a pretty scary thought. Types of allergic reaction: hives, rashes, swelling of eyes, difficulty breathing, and the really rare side effects up to 1 in 1,000 people: serious allergic reactions, tumour lysis syndrome, which is metabolic complications that can occur during treatment with cancer and sometimes even without treatment. They're caused by the breakdown products of dying cancer cells and may include the following changes to blood chemistry: high potassium, phosphorus, so basically just cells breaking down more than they would normally do. So yeah, they also go on to some unquantifiable ones, but they're not really something worth mentioning at the moment. So I think I've got some of those side effects, but not too many. But we'll just have to see how it goes. So I've got my 3rd dose today and have to keep going again on this for 2.5 more weeks. Then I'll get a week off, which would be brilliant. Yay, thank you. Then go back to clinic for some tests and then on to my 2nd set of 21 days. So things aren't going too bad now. I definitely am feeling more tired than I have been in the past, and certainly loss of appetite, and definitely after I've taken medication then I feel more washed out fairly quickly afterwards. But generally not so bad. I'm certainly not hanging over the toilet bowl trying to be sick all the time, so that's a definite bonus. But I suppose these are early days still, so let's see what happens over the next few days. Thanks for watching. If you need to, or you want to send any questions or contact, then please email me at contact@lifewithmyeloma.info, and I'll be more than pleased to answer any questions you've got, or just leave a comment and I'll try and answer those comments where I can. Thanks, and take care everybody.